Also, after giving such treatment also, you are able to see whether there is an improvement in the behavior or not. So here is intellectual functioning, learning style. So the current psychosocial stressors, his adaptive ability. So everything you include in a report. And also in reports, you include the treatment recommendations. And here also this also includes clinical interview, mental status examination, his personal, family, cultural history, and findings from standardized test. So clinicians can use these objective recommendations to develop interventions with the highest likelihood of success. Intervention ମାନେ ତୁମକୁ ସେ କ'ଣ ଦେବେ ସେଟାକୁ କରିବେ। ପିଲାମାନେ ଜଷ୍ଟ ମୁଁ ଗୋଟେ ମିନିଟ୍ ମୋର ମାନେ ମୁଁ କହୁଛି ହେଲା ଜଷ୍ଟ ଗୋଟେ ମିନିଟ୍ ୟୁ ଡିସ୍କସ୍ ଆମଙ୍ଗ ୟୁର ସେଲ୍ଫ ଆଣ୍ଡ ଜଷ୍ଟ ଫାଇଣ୍ଡ ଆଉଟ୍ କ୍ୱେଶ୍ଚିନ୍ ଫର୍ ମି ମୋତେ ପଚାରିବ କ୍ୱେଶ୍ଚିନ୍ କ'ଣ ମୁଁ ଗୋଟେ ମିନିଟ୍ରେ ତମ ଇଏ କରୁଛୁ ଆସ କୁଆଡ଼େ ଆସିବ କୁଆଡ଼େ
ଦେଖା ପାଇଁ ଆପଣ ଔଷଧ ଦରକାର ଅଛି।
ଓ ହଁ ସେଇଟା ମାନେ ପଢ଼ିଲି ମତେ ଏତେ ଗ୍ରେଟ୍ ତମେ ସାର୍ ମୁଁ ତମେ ରହିବ ଟିକେ ଘଣ୍ଟେ 15 ମିନିଟ୍ ରହିବ ନାହିଁ ସେ କ୍ଲାସ୍
ଏଇଟା ଦେଖନ୍ତୁ 5ଟା ଖଣ୍ଡି ଦିନ 11ଟା ରାତି 8ଟା ଘର 5ଟା ଖଣ୍ଡି ଖାନାଟା ଆମେ ଇମ୍ପ୍ରୁଭ୍ କরি ମାନେ ଆପଣ ଖାଲି ପେଟରେ ଖାଇବା ବେଟର ଖାଇସାରିକି ମଧ୍ୟ 15 ମିନିଟ୍
ବର୍ଷ ବାଟି ଆମର ପଳେଇବ
ହେଇସାରି ସେଟା ଅଛି
ଗୋଟେ ଅନଲାଇନ୍ କ୍ଲାସ୍ ଆଣିଲ
ଖାଲି କରିକି ଆସିବି
ଡାଇବେଟିସ୍ ବଡ଼ ଲାଇନ୍ 1 to 5 ଅଛି
ନାଇଁ ଡାଇବେଟିସ୍ ଭଲ ହେଇଯିବ ମୁଁ ଆଉ ଥରେ ଆସିବ
ବଡ଼ ଲାଇନ୍ ଅଛି
ବଡ଼ ଲାଇନ୍ 500 ମୋର 600 ହେଇଥିଲା ନର୍ମାଲ ହେଇଗଲା
ହଁ ତମକୁ ମାନେ ମୁଁ ଦେଖୁଛି ମାନେ ନିଜେ ବହୁତ ଫିଲ୍ କରୁଛି ଏଇଟା ତୁମକୁ ତୁମେ ଅଛ ତ ଭୁବନେଶ୍ୱରରେ ମୁଁ ତ କହୁଛି ଯିବି ନହେଲେ
ତାହେଲେ ମୋ ପାଖରେ ଆସିବି ମୁଁ ଆସିବି ଆପଣ କହିଲେ
ହଉ ଠିକ୍ ଅଛି ମୁଁ ଗୋଟେ ଅଛି କିଛି
ସଂସ୍ଥା
ମୁଁ କଥା ତ ନେବି ବଢ଼ିଆ ଭାରି ବହୁତ ଦିନ ଭଲ ହେଲା ତମେ ସବୁ ଏମିତି ଗ୍ରେଟ୍ ଲୋକ ସବୁ ଆସିଥିଲ ଭାରି ଭଲ ଲାଗିଲା ନା ଆଉ ଭଲ ନା ବହୁତ ବ୍ୟସ୍ତ ମୁଁ ତ ଆକ୍ଚୁଆଲି ପ୍ରକାଶ କହିଛି ଦିନେ ହଁ ଠିକ୍ ଅଛି ମୁଁ ମୁଁ କେତେ ଲେଟ୍ ୟୁ ନୋ where I am I will go and meet you also okay thank you ଆଚ୍ଛା ହ୍ୟାଲୋ
Yes, sir.
ହ୍ୟାଲୋ
ଆଜ୍ଞା ସାର୍
ଏଇ କ'ଣ ଆରେ ପିଲାମାନେ ଇଏ ଜଣେ ଡାକ୍ତର ଜଣେ ଆମର ଇଗ୍ନୋର ଷ୍ଟୁଡେଣ୍ଟ ଥିଲେ ସିଏ ମୋ ପାଖରେ କାମ କରୁଥିଲେ ତାଙ୍କର କରୁଥିଲେ ସବୁ ତାଙ୍କର କନଭର୍ସେସନ୍ ପଡ଼ିଲା ପରେ ସେ ମୋତେ ଆସିଛନ୍ତି ଦେଖା କରିବା ପାଇଁ କଷ୍ଟ ଭିଜିଟ୍ ଗୋଟେ ତାଙ୍କୁ ମନା କରିକି କେମିତି ଆମ ଦୁଆର ପାଖରେ ଠିଆ ହେଇକି ଦୁଆର ପଡ଼ୁଛନ୍ତି ସେ ଗଲେଣି ଭାରି ଆଚ୍ଛା ମୁଁ ତ ମନା କରିଥିଲି ମୁଁ କହିଲି 1 ମିନିଟ୍ରୁ ମୁଁ ତମ ସାଙ୍ଗେ ଟାଇମ୍ ଦେଇପାରିବିନି ଚାଲିଗଲେ ସେ ଶୁଣ ତେଣୁ ତୁମର ମୁଁ କହିଲି ତୁମକୁ ଇଣ୍ଟର୍ନସିପ୍ର ରିପୋର୍ଟ କେମିତି ଲେଖାଯାଏ ଜାଣିଲ ତ ବର୍ତ୍ତମାନ ତୁମର ଯେଉଁ କ୍ଲିନିକାଲ ଇଣ୍ଟରାକ୍ସନ୍ ସେଇଟା ଆସ୍ପେକ୍ଟ ଆଉ ଗୋଟେ ସାଇକୋଡାଇଗ୍ନୋଷ୍ଟିକ୍ ଫାଇଣ୍ଡିଙ୍ଗସ୍ ସେଇଟା ଆସ୍ପେକ୍ଟ ତାପରେ ଯେଉଁ ମୁଁ ତୁମକୁ ଯେଉଁ କହିଲି ଯେ ମାନେ ତାପରେ ଟ୍ରିଟମେଣ୍ଟ କରୁଛ ସେ ଗୋଟେ ଆସ୍ପେକ୍ଟ ତାପରେ ତାର ଟ୍ରିଟମେଣ୍ଟ ପରେ ତାର କ'ଣ ଇମ୍ପ୍ରୁଭ୍ କଲା କି କ'ଣ କଲା ସେ ଗୋଟେ ଆସ୍ପେକ୍ଟ ସୋ ଦେଖ ସବୁ ଗୁଡ଼ାକ ସାଇକୋଡାଇଗ୍ନୋଷ୍ଟିକ୍ ଆସେସମେଣ୍ଟ ସାଇକାଟ୍ରିକ୍ କନସଲଟେସନ୍ therapeutic suggestion, then findings of improvement, prognosis, এই ସବୁ ଗୁଡ଼ାକ ତୁମେ ସବୁ ଲେଖିବ ଗୋଟେ ରିପୋର୍ଟ ଏ ରିପୋର୍ଟଟା ଦେଖୁଛ ସେଇଟା ତୁମର ହେଉଛି ଇଣ୍ଟର୍ନସିପ୍ର ଥେସିସ୍ ବା ରିପୋର୍ଟ ହେଲା ବର୍ତ୍ତମାନ ମୁଁ ତୁମକୁ କହିବି ଇନ୍ ଇଣ୍ଟର୍ନସିପ୍ ୟୁ ଆର୍ ଗୋଇଂ ଟୁ ଡୁ ମୁଁ ତ ଆଗରୁ କହିଛି when you are under internship you are also participating in different therapeutic programs sometimes you can do individual therapy group therapy sometimes you can do counseling individual counseling group counseling your agency can ask you please come and help to these students do this. So these things are common. So now the question is, since you have to do that, so here you are going to use some therapeutic techniques. Maybe it may be psychopath. One therapy is psychotherapy. Suppose you want to change the behavior, psychological treatment. So you know that is drug therapy or a psychopharmacological treatment where you give some drugs, medicines. But apart from that, you can go for psychotherapy, a psychological treatment. So here we use psychological methods particularly which bases on regular personal interaction, and the purpose of psychotherapy is to change the person, or you help the person to change and overcome the problems in desired ways. The psychotherapy aims to improve an individual's well-being and mental health and to resolve the troublesome beliefs, compulsions. OCD compulsive therapy କହିଥିଲି ମୁଁ OCD, the compulsion, thoughts, psychotic thoughts, emotion, neurotic problem, and to improve relations and social skills. Psychotherapy ଗୋଟେ ବଡ଼ therapy technique ଯୋଉଟାକି ତୁମେ ଇଣ୍ଟର୍ନସିପ୍ରେ ଲର୍ନ କରିପାରିବ, ତମେ ବି ଆପ୍ଲାଏ କରିପାରିବ। ଗୋଟେ ସାଇକୋଲୋଜିକାଲ ଟ୍ରିଟମେଣ୍ଟ। And the advantage of this is that it highlights the quality, the interpersonal relationship on the basis for therapeutic efficacy. So all these things. As with all interpersonal relationship, communication is an intriguing aspect of psychotherapy. Predominant medium of communication involves the use of spoken language. The non-verbal means like body sculpting, drama, music, art, play, also employed for psychotherapeutic purposes. So psychotherapy, you can also use, you learn it from the experts. Also you can use it to change the behavior of your client. The psychotherapy intends to removal of distressing symptoms. It intends altering disturbed pattern of behavior. It intends improved interpersonal relationship. It intends better coping with stress life, coping with stress. So psychotherapy is very useful and intensive. You can learn it, and if you are getting scope, try to learn, because in future you would like to be a clinical consultant, even if a counselor. So some type of therapeutic knowledge is required. In a clinical field, psychotherapy, individual therapy, group therapy, behavioral therapy, or behavioral modification techniques, everything that comes under change in behavior, that is called psychotherapy. So all these things you are going to achieve in internship. So here there are, apart from so many objectives, you are actually learning some therapeutic techniques. You are learning how to interact, how to communicate with your client. You learn better communication. You try to understand people. So it improves your understanding, it improves your insight level. You can know what leads to what, why the behavior is such, and how can you change the behavior. So therefore, this is all very useful. So now I will tell you case wise detail. As I told you yesterday, we have to prepare 10 case history reports. So you have to take case studies, 10 case studies. So you have to select 10 students or 10 in a class. Suppose you are going to study, take students, or you are randomly taking 10 persons in one group. So the 10 persons on whom we are going to make a report may be referred by somebody, or you can choose randomly or on some basis. And those reports or the case study reports have to be done in such a way that by going to the report, you can immediately make an impression, make an assessment about the level of behavioral functioning or about the problem functioning or problem behavior. So now, if you like, I can give you one case study. You can know how this has been done in one agency setup. अच्छा ଏବେ ସବୁ ଟିକେ ଟିକେ ଆଇଡ଼ିଆ ହେଇଯିବନି ତୁମର. I think after I discuss all these things, you all who are hearing me must have developed a type of self-confidence to start clinical practice, clinical interview, clinical interactions, clinical findings, clinical conclusions, and above all, to help clinically to students or friends or clients who are showing disturbed behavior. I hope you are all who hear me to some extent have developed self-confidence, you change your self-concept, self-estimation. So before going to the detail of a case, I want to know whether in fact you all have developed some sense of confidence in yourself or not. So tell me whether you have really.
Yes, sir.
Very good. Okay, Suraj, I am thankful that you are, so you can do something about the girls. The girls, are you following? Are you confident enough to do something?
Yes, sir.
Yes, sir.
Good. So, this clinical consultation, diagnostic evidences, diagnostic reports, they are very interesting. You do something which leads to your psychological satisfaction in a sense. You are doing some service to a group of people who are badly in need of help and others in society. Some people, some clients who are passing their days hopelessly. So, this type of studies makes you a sense of realization that something virtue, something good, something honestly you are doing, helping people around. So if you like, I can tell you some cases. Would you like to have it? Or
Yes, sir.
actually, okay. Suppose one case has been taken. One case, the person came with anxiety disorder. Looks like having anxiety disorder. So now you are going to make a case study, some findings, some psychopharmaceutical recommendations, or some therapeutic or psychotherapeutic testing, and then you are going to give a report on his recovery and prognosis. So first of all, when you see the case, it looks like some disorder, but you don't know anything to conclude. You can't conclude. You feel like this man is having this problem, but you cannot conclude that he is having that disorder. So here, when you see the client, patient, or the student, first of all, you collect socio-demographic data. I have told you already, demographic data, like name, sex, gender, all these things. Height, weight, age. Then you tell about the status, married or unmarried. So that is all demography data. But I want to tell you here, socio-demographic data. Socio-demographic data. So here, in this process, in socio-demographic data, you are giving a lot of importance to its social level, its status, its social status, its parental positions, his social position. Just a minute, please. मैले କଥା କହିପାରିବିନି ହେଲା ମୁଁ ପଛରେ କଥା ହେବି କାରଣ ମୁଁ କ୍ଲାସ୍ ଚାଲିଛି ହେଲା ଏବେ ପିଲାଙ୍କ କ୍ଲାସ୍ ଚାଲିଛି ଅଲରାଇଟ୍ ପ୍ଲିଜ୍ am I able to be am I audible?
Yes, sir.
Okay. So intermittently some people are coming, I get some disturbance. Anyway, so now see, so I am going to give you a socio-demographic data. And socio-demographic data includes the name, the age, the marital status, married or unmarried, the gender, male or female, the occupation, whether working somewhere or a housewife. Suppose you are going to take a lady as a case study. Whether the lady is married or unmarried, whether he is a housewife or working somewhere, whether he is education level graduate or undergraduate or a matriculate or a MA, the religion, Hindu, Muslim, Christian or anything. the mother tongue, any Odia, English or Hindi like that. The location of residence, where he stays, then socio-economic status, upper class or lower class or middle class, that is depending on the economic level, the income level. Also you are writing who is going to report about or who is going to give the complaint, himself, the person himself, or somebody who has accompanied him, father, mother, brother, sister, who is telling about his complaint, or he himself. That is called informant. Who is the informant? Who informs? So write the name of the informant, either self or father or mother or anybody. Then the reliability, whether whatever he says, he looks like speaking something reliable, or he is consistent, means he is always telling the same thing. It's consistent, not changing. They have to report. Right? That is about socio-demographic data. Then you come to the chief complaints. Now you are going to see a case. So now here are the complaints. The complaints may be hard for the client itself. Then according to client or according to informant, who is informant? Suppose the client is informant, so according to client. Or if somebody else is informing, according to somebody. Who is informant? Suppose here according to client. The client is reporting like this: I am always getting fear and anxious. I have lost interest in my daily household work. Something is going on in my heart and stomach. That is something in my heart and stomach means I am getting a little bit heavier, I am getting something inside. My mind is afraid of to do any homework or to do any work. Sometimes my heart is palpitating. Sometimes I am having severe headache. I am feeling weak, both mentally and physically. My weight is reducing and also loss of appetite. So all these things are a complaint. It's giving the complaint that my appetite is decreased, my body weight decreased, I am getting headache, I am getting palpitation, I am getting heaviness in my heart and stomach, or heart, stomach. The problem is seen. I am feeling nervous, feeling anxious, feeling helpless. So these are all complaints by the client. Then what happens? You try to take the history of present illness. And you ask him that when did he have the problem? When did he start? Where? At what time? All these things. So here, suppose he said that 5 years ago, the client started showing symptoms of anxiety. 5 years back. So she had frequent attacks. She had such attacks when was in a closed space, or when he is alone at home or in a family outside a home, she was experiencing racing heart, mane palpitating, cold hands and feet, chest pain, breathing difficulty. She thought she had a heart problem. Therefore, she had gone for many physical examinations like ECG. But doing so many tests physically, but getting a report normal. Six months back, she was alone at home and fainted in the bathroom after severe anxiety attack. Therefore, the family doctor, who found no physical problem, found different testing, but he had anxiety and fell down. Therefore, he sent him, he advised him to go and see a psychiatrist. Then she had gone to a psychiatrist. She reported that she was experiencing anxiety before sleeping and living in fear. And that she may have attack at any time, as she was feeling stressed and restless, and was causing a lot of distress to family as well. She has gone for treatment to many doctors, but nothing could be helped. No doctor could help him. So now could you get, this is the report of a patient. जेटा 5 वर्ष हेलानी तब लगुच सब हेवी हेवी हार्ट लंग्स स्टमक सब टेस्ट कलानी से एंजाइटी कि मुंड कौन है एंजाइटी गला पड़गला लगे ताकू सब टेस्ट कलानी इसीजी सब कलानी सब बीपी बीपी सब कलानी सब भी नॉर्मल तो बाध्य डाक्तर जे फिजिशियन डाक्तर जे कहला वर्तमान तू देखिए गोटे साइकाट्री दिया कर सी आज पहुँचला she reported to the psychiatrist that I have gone to many doctors, but I have not got any improvement. Therefore, I have come to take your help. And the psychiatrist is now recording that, as I told you, clinical consultation report. First of all, the mind of actually is observing his talk, his mind, his perception, his behavior. Then when he takes a report about the illness, that he was getting it for 5 years, anxiety, resting, stress, all these things. Then the psychiatrist is asking, what is the mode of onset? तुम जो अटाक होची मजे मजे एंजाइटी की लगुच पड़ला भाया मुंड बुले एंजाइटी होची ए मोड ऑफ ऑनसेट किमिति होची केते बड़ होची ए मोड किमिति होची एटा द मोड ऑफ ऑनसेट एंड द साइकियाट्रिस्ट wrote down that the insidious ଇନସିଡିୟସ୍ ମାନେ ସେ ଜାଣିପାରୁନି ହଠାତ୍ ଭୟଙ୍କର ଲାଗୁଛି, ବଢି ବଢି ଯାଉଛି, ଜାଣିପାରୁନି, ସେ ଧୀରେ ଧୀରେ ବଢି ବଢି ଯାଉଛି। ଦି କୋର୍ସ ଅଫ୍ ଇଲନେସ୍ is fluctuating. ଇଲନେସ୍ କୋର୍ସ ଅଫ୍ ଇଲନେସ୍, କେତେବେଳେ କେମିତି ଇଲନେସ୍ ହଉଛୁ, କେତେବେଳେ ବହୁତ ହେଇଯାଉଛି, କେତେବେଳେ କମ୍ ହେଇଯାଉଛି। and the illness is fluctuating. The progress of illness static, বেশি প্রোগ্রেস କରିପାରୁନି। duration of years, 500 ବର୍ଷ ହେଲାଣି she suffering. duration of illness 5 years. predisposing factors, that is overthinking about family members. ତା ଯୋଗୁଁ ଫ୍ୟାମିଲି ଲୋକମାନେ ଡିଷ୍ଟର୍ବ ହେଉଛନ୍ତି, ସେ ଫିଲ୍ କରୁଛି। ତେଣୁ ଯୋଉ ଓଭର ଥିଙ୍କିଂ ଏବାଉଟ୍ ଫ୍ୟାମିଲି ମେମ୍ବର୍ସ, about father, about mother, or about others, is thinking. ଆଉ ପୁଣି କଣ ଅଛି, he had some associated disturbance like lack of sleep, or ନିଦ ହଉନି, restlessness and stress. And the perpetuating factors, that is perpetual continue କରୁଛି ନା ମଝିରେ ମଝିରେ ବନ୍ଦ ହେଇଯାଉଛି। The perpetuating factors are anxiety in psychological factors. Different factors psychological ରହିଛି, କିନ୍ତୁ ସବୁ perpetuating କିଏ ନା anxiety, ସବୁବେଳେ anxiety ରହୁଛି ମନଟେ, ମନଟା ବ୍ୟସ୍ତ ରହୁଛି, ମନଟା ସବୁବେଳେ ବିବ୍ରତ ରହୁଛି। Then you write down the past psychiatry and medical history. When many doctors failed, he went to many doctors in hospitals, told about the problem. The doctors gave him medicine, gave her medicine, but no benefit, nothing, no change. So after failing with many doctors, she took psychiatric medicines also. Like he took sleeping pills, Idovni, she took sleeping pills. She took antidepressants. So getting depressed. So she's taking antidepressant. ତମକୁ ଲାଗୁଥିବ ଡିପ୍ରେସ୍ଡ, କାମ କରିବା ମନ ହେବନି, ମାନ୍ଦାଳିଆ ଲାଗିବ, କୋଉଠି ଆଗ୍ରହ ରହିବନି। So you can take any drug like antidepressant. So he's taken this for 3 years. Sometimes she was feeling better. So when she felt better, he started medicine. Then after 6 months, again the same symptom came back. Once he stops medicine, then the sleep disorder comes back, or the symptoms comes back. Now we come to the biological functioning. So with biological functioning, you can go about the sleep, appetite, energy, all these things. Number one, the sleep, as he reports, is inadequate. The client is not sleeping well, maybe for the last 2 weeks. From 2 weeks, she having this lack of sleeping, or lack of adequate sleeping and lack of adequate comfort. So now she, when you're not having sleep for the last for past 2 weeks. Then naturally, when there is no sleep, there is anxiety in the mind also. So if there is no sleep, you get easily fatigued, you get stress, you get anxiety. Now you come to appetite. So he says, I don't have an appetite. But ଭଲ ଜିନିଷ କ'ଣ ଆସିଛି, you don't show any interest. Or you can say there is loss of appetite. The level of energy in the body is down. He is not as energetic as before. So now you can take any history about a negative history. କ'ଣ କରୁଛି ଗୋଟେ ନେଗେଟିଭ୍ ୱାର୍କ କିଛି ସପୋଜ କହିଲା ମୁଁ କିଛି କରିନି, ମୁଁ କାହାର କ୍ଷତି କରିନି, କାହାକୁ କ୍ଷମା କରିନି, ପାଟି କରିନି, କିଛି ଭାଙ୍ଗିନି, କ'ଣ କରିନି, କି ଅର୍ ନୋ ନେଗେଟିଭ୍ ଏସନ୍ ଅଫ୍ ସୋନ୍ ଏନିବଡି। ସେ କହିଲା ନେଗେଟିଭ୍ ହିଷ୍ଟ୍ରି ମୋର ନାହିଁ। ତୁମେ ଦେଖିଲ ତାର ନେଗେଟିଭ୍ ହିଷ୍ଟ୍ରି ନାହିଁ କିଛି, ଧୀରେ ବସିଛି, କାହାକୁ କିଛି କହୁନି, ଫିଙ୍ଗୁନି, କିଛି ଚିରୁନି, କିଛି କରୁନି, ତେଣୁ ସେ ନେଗେଟିଭ୍ ହିଷ୍ଟ୍ରି ନାହିଁ। Then you try to see the family history, whether she is good at the family level or not. She report kala je she has a good family with one son and a husband. Her husband ଅଛି, ଗୋଟେ ପୁଅ ଅଛି. The family environment is very smooth, and also the husband is cooperative, the son is cooperative. So family history is very good. Therefore, she seems to be very concerned with the family. She loves the family. Then you go for the personal history at personal level. You write down the birth and development history. Their birth history କ'ଣ, development history କ'ଣ, development normally ହେଉଛି ନା ନାହିଁ, that you can know from his friends, from his parents about his development status. Then you come to behavior during childhood. In childhood, how are his training days? And this lady, this client indicated that the lady was getting anxious where she was growing up, more and more anxious where she was growing up. She used to worry a lot during new changes, would not be able to sleep properly, sleep and eat properly. She has loss of sleep, loss of appetite. Described himself as a shy person. She always says that I am a shy man, shy person. Did not have many friends. But she had shared his link with some few people. Then you come to the academic history. Academically, how well he is, or how well she is. Suppose the lady have some academic achievement, you can record it. If not, you say not available. Academic history not available. Then you can go for sexual history. Not available. No person. A lady or a gents, you ask for sexual history, they are not free to give it to the person. But Sometimes the client say about his or her sex history. How many friends they had, how many their love, all these things you can also. That is sexual history. You're not saying, you say not available. Then you speak on his or her personality. Is there any pre-morbid personality? Now here the girl or here the person is one introverted one and also one anxious person. She is anxious and introverted. She is also very spiritual and has difficulty in bonding with people. Then you come to mental status examination. So look, all these things I told you now, that is psychiatric consultant, I told you earlier. Clinical consultation, that part, already over. Now we go to the other part, that is MSc or mental status examination. Here the first heading, general appearance and behavior. So what is the general appearance? She is very clean, neatly dressed. ଭଲ ଶାଢ଼ୀଟେ ପିନ୍ଧନ୍ତି, ଭଲ ଡ୍ରେସ୍ ପିନ୍ଧନ୍ତି. She is neatly dressed. That is appearance. The client has touch with surrounding. She is concerned with the surrounding. Any change is there in surrounding, he is able to locate it immediately. And also, you are observing his gait and gesture. Gait means body movement. Walking, he is walking. Gait. Gait माने होची कौन आंसर पिले गमन माने बड़े लोग जाती हली हली जाती को सीधा जाती किए को लॉय लॉय जाती is a gait, a type of walk. Then the gesture. What type of gesture is showing? Normal. Then you develop the rapport, a bonding relationship. Rapport is formed only when you are free and confide in the clinical tutor or clinical psychologist. Then you come to movement and behavior. So the psychomotor movement. Quick react করছি না, slow কোন mark করছো তুমি. So you say the psychomotor movement is normal. So his movement in the body is normal. Then the speech is normal. The productivity is normal. The client's speech is coherent and goal directed. The client's speech is coherent and goal directed. So his talking is quite good. The rate of speed is normal. There is no pressure or poverty of speech observed. So she was talking to the point, talking very nicely also. So there is no speech problem. Then we got the mood effect. So what are the mood he has coming under? Subjectively, the client may report that I am worried. Subjectively, she may say I am worried. And objectively, the client is concerned about his health. So now, the depth and the intensity of the affect is normal. The mood is observed as congruent to the thought. The mood is as per the thought. The mood is appropriate to the situation. तार मूडटा सेट इज abnormal नहीं, normal mood. I mean appropriate to the situation. Then you come to thought level. The client is preoccupied with fear towards her life. तार सब लाइफ कनसर्न काले मोर कौन हो काले एमती हम सेमती हम ये चिंताधारा ये थॉट प्रोसेस ये ऑलरेडी थॉट. So now see whether they are having any illusion, hallucination, delusion, any perceptual problem. Then you can write perception. No perceptual disturbance. Normal. The cognitive function, knowledge level, his thinking, his memory. So in cognitive level, cognitive function, the client is oriented to time, place and date. Ko time re, ko place re, ko date re. So kariba sapataka is concerned, is oriented. The attention and concentration is aroused and sustained. Is able to concentrate, able to attend. Then you come to the another heading, judgment. So the judgment of the person, the client, at personal level is intact, social level is intact, and is having insight also. Now we come to diagnosis. After we did all these things, you got the report, the clinical consultation report, and then you are going to diagnosis. The client was subjected, or the client, as per the report, the client was suspected with general anxiety disorder. He suffered restlessness, he suffered excessive worry, she suffered irritability, she suffered sleep disturbances or sleep loss. So these things are reported. In diagnostic level, you go for psychological assessment. So you can take here one anxiety inventory of Beck. Beck has done studies on depression and also studies on anxiety, and Beck has a scale called Beck Anxiety Inventory Scale. This scale is a self-report measure of anxiety. This scale contains 21 items. The reliability and validity of the test is very high. And you can see the back anxiety inventory, BAI, that is in your book also. And here you can give the testing and make assessment. So after above assessment or according to the above assessment, you can write the client is under potentiality concern level of anxiety. Then you interview with family members, spouse and concerned person. After getting all the information, you could know something about the client. Now the client is reporting about family members, spouse and the persons with whom is concerned. So now you can interview the family members, interview the spouse, your husband. Suppose the lady is here, you can interview the husband, other family members, and the concerned persons also. So here you go for your relationship statement. Either how are you with your son, how are you with your husband, how are you with your in-laws. The relationship with family members like husband, son will give idea about your concern, about anxiety, about their wellness, or concern about the support. So now here you talk with the client in a session, then you write the client's name, interview number 1, date of the interview, the time of interview, the purpose of interview. Thereby you get idea about client appearance, and also you close the session and wait for the second session. So here in this study you get an idea about the disease and what to do to improve that. So you make a plan of treatment. Then my client was advised for the following mode of treatment. So you give medication. You go to an allopathy doctor or psychiatrist, they can give you medication, drugs. Then another is psychotherapy. Try to get into psychotherapy. And breath work. The other is mindfulness. Also you are looking into the lifestyle management, how to maintain the lifestyle. So here according to the informant, you have analyzed all these symptoms. You are given the psychodiagnostic testing. You have confirmed with some type of ailments. Then you have consulted the doctors or consulted with psychotherapist. Then you have got some relief. And that you have make a report. The first one was a case study of something else. The first one, it was, as you know, it is a case study of general anxiety. Now you come to the second one. The person, the learner, has also approached for case study 2. He took the social demographic data like name, age, then marital status, gender, occupation, education, religion, mother tongue, social status, informant, reliability. So chief complaints according to patient. That chief complaint कौन? तो ये सब उठे आउट केस नेलु आमे तो एमडी तुमे गोटे पर गोटे 10टा केस नबो ए प्रति केस रे एमि तोर कंक्लूजन करिवो तापरे तुमे से गुडा सब लिखि करी तुमे रिपोर्टिंग करिवो तो को नेलो तुमे डायग्नोस्टिक टेस्ट ताकू भी देखैबो So anything else? It's all about doing in your internship report or you want to write internship report. The internship report writing is like this. So any idea? Can you do it now? I told you so many ways to deal with the patient, and this thing you are doing, you are asking the students or the patient or the client, taking all the social demographic informations, taking all the reports about his judgment, emotion, interest, all these things. That is, you are getting idea about his clinical and mental status also. Thereby you are going to make a conclusion and you are going to suggest treatment also or take treatment suggestions and we are seeing whether he has improved or not. So now you can say whether you are confident enough to do it by yourself or not. If you are able to do it, then you can do it by yourself. Just consult the psychologist. In the first meeting, you can discuss all these things. Then you can do it independently also. You can do all the 10 cases, make a report, show it to the psychologist. You can inform him about your assessment of the patient. You are informing him how you are recording or how to prepare a note about the subject, the client, how recording or noting down all these things about the client. Then your conclusion about the client. So you can write a report. And the report, another thing, when you are going to do something like internship, you are going to an agency and you write about the agency. What is the name of the agency? what is the background of the agency, or for how long the agency continuing, what is the goal of the agency, what is the social level contribution, social interactions, or social benefit rendered. So write something about the agency also. Write the name of the agency, describe about the agency, write the name of the psychologist, describe how skillful he is, write the number of students to whom you are having your interviews, write the name of the teachers, or name of the psychologist, or name of the clinicians or clinical psychologists who are helping you, show your gratitude to them. So all these also will be written. So now internship is only a report making on your experiences in that organization. Is it all fine? Hopefully, you are now knowing everything about this internship. So, in the next day on 10th, I will show you only how different instruments or tools are presented and data is collected, and how you analyze the data, and what are the questions we asked by the agency or by the academic counselor, and how should you prepare the report, whether it is binding or like spiral binding or simple binding, what the get off will be, and how can you make a chart that you are going on, which day you are going, at what time you are going. The chart will be signed by your academic counselor, who will write that the learner or the student or my learner is very duty bound, very sincere, was going on this date. So now you can ask me any question if you like. Any question? Subhasri, are you hearing me? Subhasri? Champapati, are you hearing me? Banoja?
Yes, sir.
What about the other two whom I saw in the screen but they are not responding?
I don't know, sir.
Surabhi, are you clear?
Yes, sir.
Can you do it by now? Can you do it by yourself?
Yes, sir.
Good. Suraj, how do you feel yourself? Are you confident? Suraj, I am asking you. So can you go for internship and do it independently? No response. Then Sujit. Sujit, are you there?
Yes, sir. Yes, sir.
And I'm asking, why don't you answer?
Yes, sir. Yes, sir.
Are you confident? Can you do it alone? Can you do it without also help
Yes,
of
sir.
psychologist? The entire format I have told you. To all of you, I have given the entire format. Suraj, are you there? Mr. Suraj, are you
Yes,
there?
sir, I am here, sir. Yes, sir.
But after calling you 3-4 times, you are saying yes. Why? Why are you so
Because,
slow?
sir, I went to washroom, sir.
Okay. Sapmapati, are you there?
Okay, sir.
But I find if I take case history of you people, and when I ask you for an answer, I get somebody responding after 3 minutes, somebody 5 minutes, somebody 10 minutes, somebody doesn't respond also. This is all pathological. I should have taken a record of that. That is case history. Sujata, are you clear? Sujata, are you there? Sujata, Surabhi, are you there?
Yes, sir.
Oh. So today I mostly passed out information regarding internship, and definitely it has increased your self confidence level, and now you have known the tricks, know the ways, know the processes, how to conduct the interview, how to conduct the assessment, and how to write an internship report. All right? ଯଦି ପଚାରିବ କ'ଣ ପଚାର, ଆହୁରି 15 ମିନିଟ୍ ଅଛି ନାଇଁ ରେ, ଆଉ 15 ମିନିଟ୍ ଅଛି ତ ନା ବେଶୀ?
Sir, 20 minutes, sir.
20 ମିନିଟ୍ ଅଛି, କ'ଣ ପଚାର ପଚାର। ମୋର ଗୋଟେ କ୍ୱେଶ୍ଚିନ୍, all of you listen and respond to me also. Suppose ତୁମେ ଗୋଟେ ପେସେଣ୍ଟକୁ ବା କ୍ଲାଏଣ୍ଟକୁ ତମେ ପଚାରିଲ, କିଛି ଉତ୍ତର ଦେଲାନି, ତମକୁ ଚାହିଁକି ରହିଥିଲା, ତମକୁ ଚାହୁଁଛି ଷ୍ଟେୟାରିଂ, କିଛି କହୁନି, ତ କ'ଣ କରିବ?
Sir, ତାକୁ କାଗଜ ପେନ୍ ଦବୁ, କିଛି ଲେଖିକି କହିବ, ଯାହା କହିବ କଥା।
ଲେଖିବନି? Not getting free with you, not willing to cooperate as you expect.
सर हमें रापोर्ट बिल्ड करिया को ट्राई करिवो, ताऊ कहिबो कि देख तो कथा सब कॉन्फिडेंशियल रखा जिवो, तो एटा हमें कहा पाखरे भी डिस्क्लोज करिवोनी, तो फ्री है कि कह जहा कहया कथा।
ଏମିତି ଡାଇରେକ୍ଟ କ'ଣ କହିବେ ମ୍ୟାଡାମ?
हां डायरेक्ट ही कुआ हबो।
ଡାଇରେକ୍ଟଲି କହିବ ସେ ଆଡଲ୍ଟ ହେଇଥିବ, ଯେ ସ୍କୁଲ
ଛୋଟ ପିଲାଙ୍କ
ଷ୍ଟୁଡେଣ୍ଟ
ସହିତ
ହେଇଥିବ, ଛୋଟ ପିଲା କ'ଣ କରିବ?
ପ୍ଲେ
ତାକୁ କ'ଣ
ଥେରାପି ୟୁଜ
ଶୁଣିବେନି?
ହୁଏ ନା।
They don't believe you. ତାକୁ କହିବ, but how can they believe? So you have to change in by
ଚକଲେଟ
your body
କେତେ ଦିଆ
language.
ହବ? ରେନଫୋର୍ସମେଣ୍ଟ।
So you have to do through your body language. ତାଙ୍କୁ ସ୍ମାଇଲ୍ରେ କହିବ, ଛୋଟ ପିଲା ତାଙ୍କ ମୁଣ୍ଡରେ ହାତ ଦେଇକି ତାକୁ ଟିକେ ନିଜକୁ ଆଣିବ, ନିଜ ପାଖକୁ, ମାନେ ତାକୁ ଟିକେ ଏମିତି ମୁଣ୍ଡ ଆଉଁଶୁଥିବ, ତାକୁ ସପୋର୍ଟ କରି କହିବ। ବହୁତ ପିଲା କହନ୍ତି ୟୁ ଆର୍ ଏ ଗୁଡ୍ ବୟ, ଭାରି ବଢ଼ିଆ ପିଲା ତୁ, ୟୁ ଗିଭ୍ ସାଇକୋଲୋଜିକାଲ ଟିପ୍ସ ଦବ, କେବେ ରାଗିବନି କାହା ଉପରେ, ଏମିତି ଟିପ୍ସ ଦେଇକି ଧୀରେ ଧୀରେ ତାକୁ ୱିନ୍ କରିବ। ଆଉ ଏବାଉଟ୍ ଆଡଲ୍ଟ ପିପୁଲ, ଯାହା ସୋନୁ ଲିସା କହୁଛି ତାକୁ କହିପାରିବ ଯେ ମୁଁ ତୁମର ଗୋଟେ ଭିୟୁ ନେଉଛି ତୁମକୁ ପଛକଡ଼ା ପଚାରିବି, ଏଇଟା ଷ୍ଟ୍ରିକ୍ଟଲି କନଫିଡେନ୍ସିଆଲ। ତୁମେ ଯଦି କହିବ ମୁଁ ତୁମ ବିଷୟରେ ଗୋଟେ କିଛି ଆଇଡ଼ିଆ କରି ତୁମକୁ ଜଣେଇବି ବା ତୁମର ପ୍ରୋବ୍ଲେମ୍ ଗୁଡ଼ାକ ମୁଁ ସଲ୍ଭ କରିବି। ଯଦି ଆଡଲ୍ଟ ହେଇଥିବ ସେ ତୁମକୁ ବିଶ୍ୱାସ କରିବ ଯଦି ହେବ। ଯଦି ରାପୋର୍ଟ କହୁଛ, ରାପୋର୍ଟଟା ହେଉଛି ଗୋଟେ ଟ୍ରଷ୍ଟ ବିଲ୍ଡିଂ। ତୁମକୁ ଜଣେ ଯଦି ଟ୍ରଷ୍ଟ ନ କଲା ରାପୋର୍ଟ ଗୋଟେ ହେଇପାରିବନି। ତେଣୁ ହାଉ ଟୁ ବିଲ୍ଡ ଦି ଟ୍ରଷ୍ଟ, ଦ୍ୟାଟ୍ ଇଜ୍ ଇମ୍ପୋର୍ଟାଣ୍ଟ।
through
ସବୁବେଳେ
our
ଟ୍ରଷ୍ଟ
behavior
ବିଲ୍ଡିଂ
sir.
ସବୁବେଳେ ଟ୍ରଷ୍ଟ ବିଲ୍ଡିଂ ଷ୍ଟାର୍ଟସ୍ ୱିଥ୍ ସ୍ମାଇଲ୍। ସ୍ମାଇଲ୍ କରିବ, ଛୋଟ ପିଲାଙ୍କୁ ଟିପ୍ସ ଦେବ, କାହାକୁ ଗୋଟେ କ୍ୟାଣ୍ଡିଡେଟ୍ ନେଇ ଦେବ, ଗୋଟେ କାହାକୁ କାଣ୍ଡି, କାହାକୁ ଚକୋଲେଟ୍, କାହାକୁ ଗୋଟେ ମୋଟେ ହାତ ମାରିଦେବ, କାହାକୁ କହିବ ଗୁଡ୍ ଗୁଡ୍ ବୟ, ଏମିତି କହିକି ଛୋଟ ପିଲାଙ୍କୁ। ଆଡଲ୍ଟକୁ ତୁମେ ତାକୁ କହିବ ତୁମେ ସବୁ ଅଲ୍ ଗୁଡ୍ ପିପୁଲ୍, ଗୁଡ୍ ଷ୍ଟୁଡେଣ୍ଟସ୍, ଅର୍ ଗୁଡ୍ ଚିଲଡ୍ରେନ୍, ଅର୍ ଗୁଡ୍ ମେମ୍ବର ଅଫ୍ ଦ ଲୋକାଲିଟି, ଅର୍ ସମଥିଙ୍ଗ ଲାଇକ୍ ଦ୍ୟାଟ୍। ଖୁସି ହେଲା ଭଳିଆ। ତୁମେ ବହୁତ ଭଲ ପିଲା, କାହାକୁ ତୁ କହିପାରିବ ତୁ ବହୁତ ସୁନ୍ଦର, ବହୁତ ଟ୍ୟାଲେଣ୍ଟେଡ୍, ଏମିତି କହିଲେ ପିଲା ଖୁସି ହୁଅନ୍ତି ଭାରି। ଝିଅ ପିଲାଙ୍କୁ ଟିକେ କହିବ ବହୁତ ସୁନ୍ଦର, ଝିଅ ଖୁସି ହେବେନି? ଝିଅମାନେ ଟିକେ ବିୟୁଟି ଓରିଏଣ୍ଟେଡ୍, ପୁଅମାନେ ଟିକେ ଟ୍ୟାଲେଣ୍ଟ ଓରିଏଣ୍ଟେଡ୍। ତୁ ବଢ଼ିଆ ପଢ଼ୁଛୁ, ପୁଅଟା ଖୁସି ହେଇଯିବ। ଆଉ ଝିଅ ଟିକେ କହିବ ତୁ ବହୁତ ସୁନ୍ଦର, ସେ ଖୁସି ହେଇଯିବ। ତେଣୁ ତୁମେ ପିଲାଙ୍କୁ ଏମିତି ମୁଡ୍ କରିବ, ଆଗ କଥା କହିକି ତୁମେ ଆପଣା କରିଦେବ, ସ୍ମାଇଲ୍ କରିବ, ଛୋଟ ପିଲା ପିଠି ଥାପୁଡ଼େଇବ, ଏମିତି କଲେ ଟ୍ରଷ୍ଟ ବିଲ୍ଡିଂ ହେଇଯିବ। ସପୋଜ despite all your efforts ସେ କହିପାରିଲା ନାହିଁ କି କହିଲାନି about his illness, about his behavioral problem, you want to know, ଯାହା କଲେ ବି କରିପାରୁନି, କ'ଣ କରିବ?
Sir, ତାଙ୍କ କେୟାରଟେକରଙ୍କୁ ପଚାରିବୁ।
Right, you have to go for the caretakers. You can ask the parents, ask the teachers, or you can ask the friends, or you can ask the caretaker, anything. ସବୁବେଳେ ମଦର ଇଜ୍ ଦ ବେଷ୍ଟ ଇନଫର୍ମର। ଗୋଟେ ମଦର ପିଲାଙ୍କ ପାଇଁ ସବୁ କହିପାରିବ। ମଦର୍ସ ରିପୋର୍ଟ ଇଜ୍ ଭେରି ରେଲିଭେଣ୍ଟ। ଆଉ ସପୋଜ ଗୋଟେ ପିଲା ତାଙ୍କର କହୁ କହୁ ତାଙ୍କର ଷ୍ଟ୍ରେସ୍ ଆଙ୍ଜାଇଟି କହୁ କହୁ ନିଜେ ବି ବଷ୍ଟ ଇନ୍ଟୁ ଟିୟର୍ସ, ବେଙ୍ଗ କାନ୍ଦି ପକାନ୍ତି ଦୁଃଖ କହୁ କହୁ। ସଡନଲି ଦେ ବିକମ୍ ଭେରି ଇମୋସନାଲ। କ'ଣ କରିବ ପୁଣି?
ସେଟା ତାଙ୍କୁ ବୁଝେଇବୁ ନା, ସେଟା କାନ୍ଦିବାରେ କିଛି ନାହିଁ, ତାଙ୍କୁ ବୁଝା ହବ। Try to build some rapport with them.
କ'ଣ ବୁଝିବ? ସେ ଷ୍ଟ୍ରଙ୍ଗ ଇମୋସନରେ ଅଛି, ତାକୁ କହିବ କାନ୍ଦ ନା, ସେ କାନ୍ଦିବା ବନ୍ଦ କରିଦେବ?
नहीं सर, तार भी तो उपाय ଅଛି ନା, with conversation। ମୋ ସହିତ
ଶୁଣ,
ଏମିତି ହେଇଥିଲା, ଇଏ କରାହେଇଥିଲା, ଏମିତି ଗୋଟେ ନିଜର ଏକ୍ସାମ୍ପଲ ଦେଇକି ବି ତ କରିହବ।
ଶୁଣ, ଯଦି କାନ୍ଦିଲା, ତମେ ବି କାନ୍ଦୁଛ, ଯଦି ଗୋଟେ କ'ଣ ମନେ ପକେଇ କାନ୍ଦି ପକାଉଛ, ତମକୁ ଯଦି ମୁଁ କହିବି କାନ୍ଦ ନା, ଏମିତି କାନ୍ଦ ନା, ଭଲ ନୁହେଁ, ଗୋଟେ କାନ୍ଦ ନା, ବନ୍ଦ କରିଦେବ ନା? ଯେତେବେଳେ କାନ୍ଦିଲା ମାନେ ତମେ ଆଗ ଗୋଟେ ସେକେଣ୍ଡ, ଗୋଟେ ମିନିଟ୍ ଖଣ୍ଡେ ୱାସ୍ କରିବ, କାନ୍ଦୁ, ତାପରେ ପିଠି ପଡ଼ିବ, ତୁ କାହିଁ ତୁ ଏମିତି ବ୍ୟସ୍ତ ହେଉଛୁ, ତୁ ଏତେ ଭଲ, ଏତେ ଇଏ କହିକି ଟେକା ଟିକେ ପୁଣି ଆଣିବ ତୁ ପାଟକୁ। ତୁ ଯଦି କାନ୍ଦିଲା ବେଳେ କହିବ କାନ୍ଦିଲା ବୋଲି, କାମ ଦେବନି। ଆଗ ୱାସ୍ କରିବ, ଅଧ ମିନିଟ୍ କାନ୍ଦଉ, ତମେ ତମ ଲେବୁଲରେ ଭାବୁନ। ଘରେ କାନ୍ଦୁଛ କେତେବେଳେ, କ'ଣ ପିଲା ହେଇଥିଲେ କାନ୍ଦି ପଡ଼ୁଥିଲ, ବାପା କହୁଥିଲେ କାନ୍ଦିନା, ବନ୍ଦ ହେଉଥିଲ କାହିଁ ସାଙ୍ଗେ? ତୁମର ସବୁ ପ୍ରଥମେ ତୁମେ ଆଗ ଅଧ ସେକେଣ୍ଡ କି ମିନିଟ୍ ଖଣ୍ଡେ କାନ୍ଦି ପକାଅ, ତା ମନକୁ ଚେଞ୍ଜ ଚାଲିଯିବ। ଏଠି ଯୋଉ ମାନେ ବଷ୍ଟ ଆଉଟ୍ କରିଯାଆନ୍ତି, तुम्हें रिहर्सल कर वाश कर तो कह धीरे धीरे कौली कौली कह स्माइलिंग स्माइल्स एंड सॉफ्ट बेले बेले प्रॉब्लम हुए सपोज यू आर ए क्लिनिकल काउंसलर you are a female and the client is a male आमर काउंसलिंग रे प्रॉब्लम हुए काउंसलिंग रे बेले बेले माने गोटे मेल काउंसलर फीमेल क्लाएंट और द रिवर्स मध्य संपर्क छुटी जाए काउंसलिंग बंद हो सी झील कांद कह मुझे आसबि पुओ भी कांद एमती मैंने गोटे संपर्क बिल्डअप हो जाए तुम्हें भी जो कर कम स्कूल स्टडी कर पिला दौच कि कैंडी दौच कौन दौच मिसी पाखे जब छाड़ तुम्हें से स्कूल से भी तुम मन पकड़ कांदी कांदी तुम भी मन दुख हम ह्यूमन माइंड नेचुरली सॉफ्ट अटैचमेंट हो जाए बेले बेले टेस्ट दब डायग्नोस्टिक टेस्ट दब डायग्नोस्टिक टेस्ट अप्लाई कर दौच डायग्नोस्टिक टेस्ट बुक दौच क्वेश्चन दौच से भी क्वेश्चन देख उत्तर न देख गोटे खाम ख्याल भाव पकई पारती भी देखो कौन कर सब गुड़े अच्छी यू आज ए मिनी साइकोलॉजिस्ट because you are going to learn from the psychologist. So you have to also practice yourself how to act in that strange situation. बेले बेले से माने तुम पे कौन आनी गोटे भल मैडम देखते छोट छोट पिला स्कूल भल मिस गोटे मिस भल मैडम मैंने देखले सी भारी स्माइलिंग भारी हेल्पिंग भारी गेल कर से गोटे फूल नहीं आसवे गोटे फूल दवाई मैडम को कौन कर तुम्हें मना करदेव कौन कर सुरभि तुम भी गोटे छोटिया स्कूल कम कर
सर
फूल देला आनिक कौन कर
सर ग्लाडली नेबी सर
लाज कर तो ये कौन फूल फूल देलानी
ना 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 बिल्कुल नहीं
बेले बस कर दब तुम एजमेट कि बस कार्ड जन दब
हाँ
कौन
सेटा भी नेबी
भरोसा
सर थैंकफुल है भी
तुम गोटे गिफ्ट दब कि फूल दब कौन कर
सर फुलरे किसी असुविधा नहीं सर चलिबो
हाँ से भारी माने माने यू कॉन्सेप्ट एक्चुअली यू बिकम वेरी फ्री क्या मन में आघात दबनी हठात तापर तुम आभोड करदेव आरंभ रू थैंक यू कह सब अच्छे बहुत जिन तुम्हें कराया पड़ो कारण तुम बिकज यू आर गोइंग टू बी स्टूडेंट्स इन ए स्ट्रेंज सिचुएशन तेणु तुम बिहेवियर एमती हम जे तुम जन भल पाइबे ताले रापोर्ट फर्मेसन हम जहाँ पचारे कह सी कहे तुम तुम घरे भाई भौणी पचारे भी कहे सब बापा पूरा पिला पचारे पुओ जो सी पूरा सब सत कहे केमती आदाय करा पड़ो ट्रिक गोटे तो सब बड़े यू ट्राई टू मूड योर सेल्फ you mold yourself, you change yourself to become acceptable to them. They should accept you. अच्छा आपको पता रही आपा आप कौन सब अच्छी so now you can ask me if you like କ'ଣ ପଚାରିବ ନା ନାଇଁ ବନ୍ଦ କରିଦେବା? ଆଜି ତୁମକୁ ପଢ଼ିବା ପାଇଁ କଣ୍ଟେଣ୍ଟ ଏତିକି। ମୁଁ ତୁମକୁ କହିଛି ସାଇକୋଥେରାପି ଉପରେ କହିଛି। ବେବେ ତୁମେ ସାଇକୋଥେରାପି ଏଠି ଶିଖିବ, ପ୍ରାକ୍ଟିସ୍ କରିବ। ଏଇଟା ଗୋଟେ ତୁମ ପାଇଁ ଅପରଚ୍ୟୁନିଟି, ଇଣ୍ଟର୍ନସିପ୍ଟା। ବହୁତ ଲୋକ ସାଇକୋଲୋଜି ପଢ଼ନ୍ତି ମାନେ କହନ୍ତି ଆମେ ମନ ଜାଣିବୁ, ଟୁ ନୋ ଦି ମାଇଣ୍ଡ। ଏଇଟାକ ସବୁ ଯେଉଁ କହୁଛ ମନ ଜାଣିବୁ ବୋଲି, ତୁମେ ଆକ୍ଚୁଆଲି ତୁମେ you have to do psychotherapy to change behavior, to help people, to know their mind, their problem. So their psychotherapy can help you. ମୁଁ କେତେବେଳେ ନିଜେ କରିଛି ଗୋଟେ ଆମର ସାଇକୋଥେରାପି ଗୋଟେ ଅଛି, ଆମର ଗୋଟେ ବିହେଭିଅର ଥେରାପି ଅଛି, ଆଉ ବିହେଭିଅର ମଡିଫିକେସନ୍ ଅଛି। ଆମର ଟେକ୍ନିକ୍ କେତେ ଗୁଡ଼ା ଅଛି, ଟେକ୍ନିକ୍ସ ଅଫ୍ ସିଷ୍ଟମାଟିକ୍ ଡିସେନ୍ସିଟାଇଜେସନ୍। ଯାହା ଯେଉଁ ଟେକ୍ନିକ୍ରେ ତୁମର ଭୟ କ'ଣ ଥିବ କାହା ମୁଁ ଛଡ଼େଇଦେବି। ବହୁତ ପିଲାଙ୍କର ଭୟ ଥାଏ ଏଇ ଯେଉଁ ଲିଜାର୍ଡ ପ୍ରତି, ଝିଟିପିଟି ଭୟ, ଅସରପା ଭୟ, ବେଙ୍ଗ ଭୟ, ଏମିତି ନାହିଁ? କ'ଣ ବନଜା, ବେଙ୍ଗ ଫେଙ୍ଗ ଭୟ ନାହିଁ?
ସାର୍ ମୁଁ ବେଙ୍ଗକୁ ଡରେନି।
ଡରନି? ଝିଟିପିଟି?
ସାର୍ ନା, ଝିଟିପିଟି ବି ଏତେ ଡରେନି, ମୁଁ ସେମିତି ଡରେନି।
ବହୁତ ଝିଅଙ୍କର 70% ଅଫ୍ ଦି ଗର୍ଲସ ଦେ ଆର୍ ହାଭିଂ ସଚ୍ unusual fears. ଏମିତି ପୁଅ ପିଲାମାନେ ରହନ୍ତି ମଧ୍ୟ। ଗାଈ କି ଦେଖେ ଡର, ଗାଈ ଦେଖି ତୁମେ ସବୁ ଡରିଯାଅ। ଏଠି ପୁଅ ପିଲାମାନେ ତ ଡରିବେନି, ଝିଅ ଡରିଯାଆନ୍ତି ବହୁତ। ବହୁତ ଡର ଲୋକ ଥାଏ। ଏଇଟା ତୁମର ଭାଇ ସାଇକୋଥେରାପି ଏଇଟା ସବୁ ଆମର ଯେଉଁ ଡିସେନ୍ସିଟାଇଜେସନ୍ ଟେକ୍ନିକ୍ରେ ତୁମ ଯଦି ପାଖେ ବତେଇ ଦିଅନ୍ତି କେମିତି ହାଉ କ୍ୟାନ୍ ୟୁ ଚେଞ୍ଜ ବିହେଭିଅର। ଗୋଟେ ଝିଅଟେ ମୁଁ ଷ୍ଟଡି କରୁଥିଲି, ଗୋଟେ ଝିଅଟେ କ୍ଲାସ୍ 9th ପଢ଼ୁଥିଲା। ତା ବାପା ମା ସାଙ୍ଗ ସେ କହିଲେ ଯେ ଝିଅ ଦେଖିଲେ, ସମୁଦ୍ର ଦେଖିଲେ ସେ କାନ୍ଦେ ଖାଲି। ସେ ପୁରୀ ଯିବ, ଗୋଟେ ସମୁଦ୍ରକୂଳ ଯିବାକୁ ଚାହିଁବନି, ସେ ଡର। ତାକୁ ଥରେ ମୁଁ ଛଡ଼େଇବାକୁ ପଡ଼ିଲା ତା ଭୟଟାକୁ। ତୁମ ଘରେ ଦେଖିଥିବ ବାପା ମା ମାନେ ସବୁ ଛୋଟ ପିଲାକୁ ଗାଧେଇଲା ବେଳେ ଛୁଆ କାନ୍ଦେ, ତାକୁ ବୁଝେଇବେ ଗାଧେଇଲେ ଭଲ ଇଏ କର, ବୁଝିବ ସେ ଛୋଟ ପିଲାକୁ? କ'ଣ କରନ୍ତି, ପାଣି ଟାଙ୍କୁରି ବୁଡ଼େଇ ଦିଅନ୍ତି। ଥରେ 2 ଦିନ ବୁଡ଼ାବୁଡ଼ି କରିଦେଲେ ତା ଭୟ ପଳେଇବ ସବୁ, ହୁଏନି? ଆଉ ଟେକ୍ନିକ୍ସ ଅଛି, ଫଡ଼ିଂ ଟେକ୍ନିକ୍ସ, ଡିସେନ୍ସିଟାଇଜେସନ୍ ଟେକ୍ନିକ୍ସ, ଟେକ୍ନିକ୍ସ ରହିଛି, ଏସବୁ ଅଛି ସବୁ। ତେଣୁ ବର୍ତ୍ତମାନ ଆରେ ବନ୍ଦ କରିଦେବା ଥର ନା ପଚାରିବୁ କ'ଣ ହଉ? କ'ଣ ଗୋଟେ ପଢ଼ିଲାଣି ନା ଜାଣିବନି।
ସାର୍ ବନ୍ଦ କରିଦେବା।
ବନ୍ଦ କରିଦେବା?
ଆଜ୍ଞା।
ଓକେ, ଥ୍ୟାଙ୍କ ୟୁ। ତୁମର ଆଜି ବି ଯାହା ତ ତୁମକୁ ସବୁ କହିଦେଲି ପୁରା ଅଲମୋଷ୍ଟ କେମିତି କ'ଣ କରିବ ବୋଲି। ଆଉ ତୁମର କିଛି ଅବସ୍ଥା ନାହିଁ, ୟୁ କ୍ୟାନ୍ ଡୁ ଇଟ୍ ବାଇ ୟୋର୍ ସେଲ୍ଫ। ତୁମେ ତୁମର ଖୋଜ, ଗୋଟେ ଇନଷ୍ଟିଚ୍ୟୁସନ୍ ଖୋଜ କେଉଁଠି କରିବ, ଏବଂ ତାପରେ ସବୁ ବୁଝିକି ତାଙ୍କୁ କହିକିରି ତାପରେ ଜଣା ସେଣ୍ଟରକୁ ଏଠୁ ଚିଠିଟା ନେଇକି ଯାଅ। ଯଦି କେଉଁଠି ନ ପାଇଲ, ଅସୁବିଧା ହେଲା ମୋତେ କହିଲେ, ମୁଁ ତୁମକୁ ଦେଖିବି କେମିତି ତୁମକୁ ସାହାଯ୍ୟ କରିପାରିବି, ହେଲା? ସୋ ଥ୍ୟାଙ୍କ ୟୁ, ୟୁ କ୍ୟାନ୍ ସି ୟୁ। ଆରେ ଆଉ ଟାଇମ୍ ହେଇଗଲାଣି ନା, ଟାଇମ୍ ଅଛି ଆହୁରି?
5 minutes sir।
ଠିକ୍ ଅଛି।
ସାର୍ କନସେଣ୍ଟ ଲେଟର ପାଇଁ ନିଜେ ଯିବାକୁ ପଡିବ ନା ଆଉ କିଏ ଗାର୍ଡିଆନ ଗଲେ ବି ଚଳିବ?
ହଁ, ତମେ ତମକୁ ନେଇକିରି ଦେଇଦେବ, ଏନିବଡି କ୍ୟାନ୍ ଗିଭ୍ ଫର୍ ୟୁ।
ସାର୍
ତମେ ଦେଇପାରିବ ନେଇକିରି, ବା ତମ ପାଇଁ ତମ ଗାର୍ଡିଆନ୍ ଦେଇଦେବେ। କ'ଣ
ଓକେ ସାର୍।
ତେବେ ତ ଜାଣିବା କଥା, ସିଏ ପାଇଲା ଚିଠିଟାକୁ ସିଏ ଜାଣିଲେ ତୁମେ ସେ କରିବ, ତମକୁ ସେ କହିବେ ଯେ ଆସିବା ପାଇଁ କୋଉଦିନ ଗୋଟେ, ଆଉ କ'ଣ?
ସାର୍ ସାର୍
सर ये जो रिपोर्ट प्रिपरेशन ना किसी गोटे फॉर्मेट हमको मिल पारिबो कि प्रीवियस ईयर स्टूडेंट कर कि कहार कौन थिबो?
ए रिपोर्ट राइटिंग बेले
आज्ञा
फॉर्मेट दे हो जे मो पाखे सब अच्छे लोक कि नहीं सब कौन अच्छे सब बात लोक नहीं कहीं फेरुना
आज्ञा
ମୁଁ ଗୋଟେ ରଖିଛି ଗୋଟେ ମୋର ନିଜର ମୁଁ ଦେଖେଇ ଦେଇପାରିବି ମାନେ ରିସେଣ୍ଟଲି ସେମାନେ କରନ୍ତି ତା କପି କରିଦିଅନ୍ତି ମୋତେ ଗୋଟେ କପି ଦେବାକୁ ପଡ଼େ କାହିଁକି ନା ତମର ଯେ ହଜିଗଲା ଇଣ୍ଟର୍ନସିପ୍ ରିପୋର୍ଟ ମୋତେ ଯିଏ ତମର କାଉନସିଲର ଅଛି ତା ପାଖେ ଥିଲେ ସେ ତମର ସାଙ୍ଗେ ମେକଅପ୍ କରିଦେବ ହଜିଗଲେ ସେ ପୁଣି ବର୍ଷେ ପରେ କହିବେ ମିଳୁନି ତମେ ଆଉ ଥରେ ଦିଅ ବୋଲି ତମ ରିପୋର୍ଟ ଯୋଉ କରିବ ଗୋଟେ ରଫ୍ କପି କରିଥିବ ଗୋଟେ କରିଦେଇ ଏକାଡେମିକ୍ କାଉନସିଲର ତମ ସୁବିଧା
सर कौन एटा रिपोर्ट हैंड रिटन हबो ना एमती टाइप कर कंप्यूटर रे सर?
टाइप କରିଦେବ କମ୍ପ୍ୟୁଟରରେ ଯଦି ବାଇଣ୍ଡିଂ ନାହିଁ ତମେ ଲେଖିପାରିବ ହାତରେ ଯେ ଟାଇପ୍ କଲେ ବେଟର ଗୋଟେ ଆଖି ଦୃଷ୍ଟିଆ ନୁହେଁ
टाइप
ନମ୍ବର
कले
ଫମ୍ବର
बेटर आखि दृष्टिया प्लस निज पाखे रही गला गोटे कॉपी हैंड
ହଁ କପି
रिटन
ରହିବ
हेले गोटे कॉपी ही लेखि हबो दीटा लेखिबा पॉसिबल हबोनी
ଆରେ ହାତରେ ଲେଖିଲେ ଫଟୋ ତାକୁ ଜିରୋକ୍ସ କରିଦେବ
आज्ञा
ଗୋଟେ ଗୋଟେ ପିଲା ଲେଖନ୍ତି ହାତରେ ଏତେ ସୁନ୍ଦର ଯେ ସେ ଟାଇପ୍ କଲାଠୁ ଆହୁରି ସୁନ୍ଦର ଦେଖାନ୍ତି
सर केतेटा केस स्टडी रे रिपोर्ट लेखिया पड़े?
କେଟା କ'ଣ
केतेटा हमको मिनिमम केतेटा केस स्टडी रा रिपोर्ट करिया पड़े रिपोर्ट रे?
ଏଟା କେସ୍ ଷ୍ଟଡି
आज्ञा
10ଟା ପରା
आज्ञा 10टा
10ଟା କେସ୍ ଷ୍ଟଡି କରିବ ଯୋଡ଼େ ଆଟଲିଷ୍ଟ ତାକୁ ଦେଇକିରି ଇଣ୍ଟରଭେନସନ୍ ଦେଇକିରି ତାପରେ ରିପୋର୍ଟିଂ କରିବ ଏହା ଦେଲି ଇମ୍ପ୍ରୁଭ୍ କଲା କି ନାହିଁ 10ଟା ପରେ ଲେଖିବ କେସ୍ ଷ୍ଟଡି ସବୁ ଉପରେ ତୁମେ ଇଣ୍ଟରଭେନସନ୍ ଦେଇପାରିବନି ଟାଇମ୍ ମିଳିବନି ଯୋଡ଼େ ଆଟଲିଷ୍ଟ କରିକି ତାକୁ କରିପାରିବ
आज्ञा सर
ହେଲା
आज्ञा
ଆଉ ତମର ତ ଯୋଉଠି ଯାଇ କରିବ ଏଠି ଆଗରୁ ପିଲା କରିଥିବେ ତାଙ୍କର କପି ଥାଇପାରେ କପି ଆଣି ଦେଖିବ କେମିତି କରି ଲେଖିଛନ୍ତି ସବୁ
आज्ञा सर
ନ ପାଇଲେ କୋଉଠି ମୋ ପାଖକୁ ଆସିବ ଆଉ ମୋତେ ପଚାରିଲେ ମୁଁ ଯାହା କରିବି ଗୋଟେ କ'ଣ ଆଉ
आज्ञा ठीक আছে
ଆଁ
आज्ञा
ମୋତେ ପଚାରିଦେବ ଭାଇ କ'ଣ ପ୍ରୋବ୍ଲେମ୍ ତୁମର କହିଦେବି ମୁଁ ଆଚ୍ଛା ଆଉ ସବୁ
सर मोर आपन कथि गोटे पर्सनल हेल्प आर वर्ष मु तो किसी कांटेक्ट पाउनी जोटा हमर 7 थिला प्रैक्टिकल ता सेटा मु देइनी
ଦେଇନ କାହିଁ
सर मु आ जानि परलिनी टाइम का कोन तार किसी प्रिपेयर कर नथिल कि देइनी ताकू सर मु वर्ष केमति क्लियर करी
ଏବେ କହିକି ଯାଅ ସେଣ୍ଟରକୁ ଯାଅ ଏଠି ଅକ୍ରୁର ଅଛନ୍ତି ଅକ୍ରୁର ବାବୁଙ୍କୁ ପଚାରିକିରି ସେ କହିଦେବେ ନହେଲେ ଆମର ସେଠି ଯିଏ ଚେନା ବାବୁ ଆମର ଅସିଷ୍ଟାଣ୍ଟ ଡାଇରେକ୍ଟର କି ବିମଳ ବାବୁ ଡେପୁଟି ଡାଇରେକ୍ଟର ଏ ଅଛନ୍ତି ତାଙ୍କ ସହିତ ଦେଖା କର ତ ବତେଇବେ ତୁମକୁ ଆଉ ତାର ପରୀକ୍ଷା ପ୍ରାକ୍ଟିକାଲ ପରୀକ୍ଷା ସବୁ ହବ ହେଇନି ବୋଧେ ଏ ମାସ ଏଣ୍ଡରେ ହବ ବୋଧେ ତା ପୂର୍ବରୁ ସବମିଟ୍ କରିଦିଅ
सर जाउची जते थर सेठी बहुत थर गलिनी से गोटे प्रॉपर गाइडेंस मते मिलुनी से माने एक्चुअली बही बुक मिली नथिला आमे निजे जाकी खोजी के आनथिलु तो सेते बेला आमे जानि नथिलु जे मु
ତମେ
प्रैक्टिकल
ତମର
बुक
ପ୍ରୋବ୍ଲେମ୍
आनी
ନା କ'ଣ କହୁଛନ୍ତି ମୁଁ ଆକ୍ଚୁଆଲି ମୁଁ ବି ତାଙ୍କୁ ଧରିପାରୁନି ତମେ କାହିଁକି ଦେଇପାରିଲନି ମୋତେ ଯଦି ମୁଁ ଆଇ ଥିଙ୍କ ଯଦି ମୁଁ ଜାଣନ୍ତି କେମିତି କ'ଣ ବାଟ ବତେଇ ପାରନ୍ତି
आज्ञा
anyway, we will
तो सर
discuss
आज्ञा सर मु ताले
ଏଇ
आपन को फोन
ପ୍ଲାଟଫର୍ମରେ
करबी
ନୁହେଁ
जते पर्सनल कथा है
ତମର ପ୍ରାକ୍ଟିକାଲ ପାଇଁ ଯାହା ପଚାରିବ ଅଲଗା ପ୍ଲାଟଫର୍ମ ଏଥିରେ ନୁହେଁ
आज्ञा आज्ञा आज्ञा
ପଚାରିବ ମୁଁ ତାକୁ ଦେଖିକି କ'ଣ କରିହବ ହେଲା
आज्ञा
ଏଇ ପ୍ଲାଟଫର୍ମରେ ତୁମର କେବଳ ଆଜି ତୁମେ ଇଣ୍ଟର୍ନସିପ୍ ପଚାର ଇଣ୍ଟର୍ନସିପ୍ ଆଉ ଗୋଟେ ନେକ୍ସଟ କ୍ଲାସ୍ ଇଣ୍ଟର୍ନସିପ୍ ନେବି ତୁମକୁ ଆଉ କେତେ କେସ୍ ଉପରେ କହିବି ତୁମକୁ ତାପରେ ତୁମର ଯଦି କିଏ କରିବ ପ୍ରୋଜେକ୍ଟ ଉପରେ ତୁମକୁ କହିଦେବି ତାପରେ ତୁମର ତୁମେ ଲେଖାଲେଖି କରିବ
आज्ञा
ଇଣ୍ଟର୍ନସିପ୍ କଲାବେଳେ ମୋତେ ଯଦି କହିପାରିବ ମୁଁ ତୁମକୁ କହିଦେବି କେମିତି କ'ଣ ଆରମ୍ଭ କରିବ ବୋଲି ଆଉ ତୁମେ ନିଜେ କରିବ ଯଦି ମୁଁ ତ ସବୁ କହିସାରିଲି ତୁମକୁ ଅଲ୍ ଦି ଷ୍ଟେପ୍ସ ନିଜେ କରିବ ଯଦି ତାପରେ ସବୁ ଯେମିତି ସବୁ କରୁଥିବ ସାଇକାଟ୍ରିଷ୍ଟ କିଏ ଥିବେ ଯଦି ତୁମ ଇନଷ୍ଟିଚ୍ୟୁଟ୍ କରୁଛ से केमती केमती करछन्ती ताको गोटे केस देखिबो केमती करछन्ती से ग्रुप कि इंडिविजुअल कि साइकोथेरापी कि कोन जिंस करछन्ती से तो देखिबो देखि तुम ताको इंटरनलाइज करिवो शिखिबो तुम जेटू आ को रोग पे को औषध दिया होची कार निद होनी औषध देले कागु डिप्रेशन को औषध देले डॉक्टर्स आर नोइंग तुम्हें भी एटलिस्ट फ्यूचर तो सांग फंग का प्रोब्लेम सांगर का प्रोब्लेम हम कि कमती आउ किए तुमको पचारे हेल्प पचारे तुम तो आइडिया किसी हो तुम्हें निजे ताकू गोटे तो रेकर्ड कर पार जमी तुम कहली मु क्लिनिकल रेकर्ड गोटे आ गोटे हूँ एमएससी कर तुम्हें यू कैन सेंड हिम टू साइकेट्रिस्ट और यू कैन सेंड हिम टू मेडिकल सांगे जो मेडिकल जीव तेणु यू कैन डू समथिंग
Yes, sir.
ओके
Thank
रक्षा
you.
सर
आज्ञा sir. Thank you, sir. Sir,
हाँ
नमस्कार.
नमस्कार नमस्कार थैंक यू ऑल शुभश्री शांति प्रिया ना हेलो शुभश्री आर यू देयर शुभश्री शांति प्रिया